and you feel your heart pounding, well, that actually might be an increase in your blood pressure. So we know intuitively, yes, stress does lead to high blood pressure, and it's really important that we manage our stress to prevent it from developing. Breathing exercises, meditation, yoga, all of these things can help prevent the increase in blood pressure and can help manage our stress. And you know what? It's really important that we manage our stress because we have to prevent high blood pressure. If you have a family history of high blood pressure, please go to your doctor, because this is one of those things that we see in families. And oftentimes I see young women in my office with a strong family history of high blood pressure, and they too have it and would never have known it unless they got it checked. It's the silent killer, and about 30% of Americans don't know that they are suffering from high blood pressure. So know your family history, and if you're an African American woman, you are also at greater risk. And all you have to do is stick out your arm and get your blood pressure checked, and that's how you'll know.
Well, the risk factors of stroke are many, but the number one risk factor for stroke is high blood pressure, or your doctor may say hypertension. It's because the pressure within the arteries are suddenly building up, and one day maybe the arteries rupture, allow blood to spill in the brain, or maybe they close down and don't allow enough blood to get to the brain. So high blood pressure, number one risk factor for stroke. Also diabetes, where people have very high sugar in their blood. It makes the blood vessels, instead of being nice and open, makes them very irregular and jagged, so that less and less blood flow gets to the brain. Another risk factor is smoking, right? We all know that smoking's bad, but smoking's particularly bad for the brain, so it can cause or increase someone's risk of stroke. Heart disease, when people have certain problems with their heart, since the heart is the pump, doesn't allow enough blood to get to the brain, and that's what causes a stroke. In addition to inactivity, being overweight, that increases your risk of a lot of the diseases we're talking about, high blood pressure, diabetes, but also increases the risk of stroke. So it's important to partner with your doctor. Talk to your doctor about what your individual risk factors are in order for you to modify them or change them appropriately, which might include lifestyle changes, exercise. Sometimes medication is appropriate. So again, it's a communication or open lines of communication with your doctor in order to identify your risk factors for stroke and change and modify them appropriately so you can reduce your risk of stroke.
We've all heard the phrase, 40 is the new 30. With all the advancements made in medicine over the recent decades, you can feel youthful at just about any age. But heart disease doesn't just affect the elderly, contrary to popular belief. So no matter how good you might feel, it's critical you take steps to take care of your heart now, in an effort to prevent or delay cardiovascular disorders later in life. For instance, the American Heart Association notes that even as early as childhood, plaque can start to build up in the arteries. This plaque buildup can lead to clogged arteries down the road. And as obesity, type 2 diabetes, high blood pressure, and physical inactivity are becoming more and more common, even young and middle-aged people are developing heart problems. According to the CDC, half of all Americans have at least one of the top 3 risk factors for heart disease, which are high blood pressure, high cholesterol, and smoking. Aging is what is called a non-modifiable risk factor. As of yet, we've not found any way to reverse aging. We know that aging may cause changes in the heart and blood vessels, and those changes may increase a person's risk for cardiovascular disease. In men, the risk of heart attack increases significantly at age 45. But we also know that certain risk factors can increase the odds for developing cardiovascular disease, which influence the rate of aging in a healthy heart and the arteries. These are things like getting physical activity, eating a heart-healthy diet, and not smoking. So, if you're in your 40s and feeling great, get into the habit of taking care of your heart. Eat healthy, get exercise, reduce stress, stop smoking. It'll pay dividends in the long run.
There are many different types of heart disease, so the causes really depend on the type of heart disease you have. cardiovascular disease is a disease of your blood vessels that starts with breaks in your blood vessels caused by weak junctions between the cells lining your artery. We call that atherosclerosis, the buildup of fat-laden plaques in your arteries that surround your heart. These plaques develop over years due to poor diet, lack of exercise, obesity, smoking, and they cause the arteries themselves to become stiff and to start to close off. When a plaque ruptures, clots then block an artery, so blood can't get through, and this results in a heart attack. Other types of heart disease, like abnormal beats or what we call heart arrhythmias, are caused by too much or too little of a medication, electrolyte imbalances in the blood, high blood pressure, or excessive use of alcohol or caffeine. Still, other forms of heart disease are caused by infections that develop in your heart muscle, or from defects in heart muscles, or just old valves. Major risk factors for heart disease include high blood pressure, obesity, poor diet, a strong family history, and even unmanaged stress. Your chances of developing heart disease increase as you get older.
Heart disease is the #1 killer of both men and women, and in many cases, those deaths are unnecessary. It's important to learn all the signs and symptoms of heart disease, and more specifically heart attack, so you can avoid being one of these statistics. Although the most obvious symptom of heart attack is chest pain, it's certainly not the only one and not as common in women. Other symptoms seen in men and more commonly in women with heart attack can include shortness of breath, weakness or heaviness in the arms and legs, overwhelming fatigue, or pain in the neck, jaw, or back that won't seem to go away. Depending on the type of heart disease that's present, you may also feel fluttering in your chest, your heart skipping beats, lightheadedness, dizziness, or tire very easily during exercise. Some of these are causes for immediate concern and may be signs of a heart attack. Others may signal a long-term problem, but all of them signal it's time to see your doctor. Many causes of heart disease are treatable with diet and exercise modifications, medications, or surgery, but if left untreated, they can be fatal. If you're concerned, don't wait. See your doctor as soon as possible. And if you're experiencing what you believe is a heart attack, call 911 immediately.
Treatment for heart disease depends on the specific causes, but generally comes down to 3 things: lifestyle modifications, medication, or surgery. For any of the types of heart diseases caused by obesity, poor diet, or lack of exercise, your doctor will likely suggest making major changes to your diet and exercise regimen. Low fat, low cholesterol, low sodium, low carb, and even Mediterranean diets can be used in various circumstances. But generally, sticking to whole natural foods and staying away from highly processed foods will help. Medication options for heart disease vary by the type of disease you have, but drugs used to treat high blood pressure and high cholesterol are very common choices. If you've had a heart attack or other blood clotting problem, your doctor may prescribe blood thinners. And if you're having heart rhythm problems, drugs that regulate those rhythms may also be a good choice. Finally, surgery, whether to open blocked arteries, fix broken heart valves, or even install a pacemaker to keep your heart on track, is another very common procedure. Many times, doctors will use a procedure called an angiogram, where dye is injected into the blood vessels around the heart through a catheter in your groin to see exactly what's going on with your cardiovascular system. The best course of action, though, depends on the type of condition you have. So getting in to see your primary care doctor or a cardiologist early can help treat the problem before it becomes life-threatening.